Well, welcome to Thursday Zoom. Today we're going to be reviewing the final. Okay, so the final is not going to be open until next Wednesday, but I'm going to review it today simply because I'll open it tomorrow afternoon, and you guys will have that time to take it. But then we're off Thursday, Friday, Saturday, and Sunday next week for Thanksgiving Day, the Friday after Thanksgiving, and that weekend. So we have a 4-day weekend. And so I'm going to be leaving everything open. Well, the assignments that you need extensions on, I can extend them a little bit, but I have to have grades in Monday morning after Thanksgiving. So we're lucky that we have that 4-day weekend, but I still have to work within the policy on that. But there's going to be 2 parts to your final. There's going to be part 1, and there's going to be a coding part 2. So what we're going to go over heavy today is the true and the false, and the multiple choice. Okay, so let's go over that. Now, this is not going to be, I think I put a study guide that's going to look exactly like this in one of your lessons for next week. Let me ask you a question. Do you think that the questions that we're going to be going over right now are going to be the questions that are going to be on your final exam?
I mean, we're preparing for it, so I'm pretty sure they will be.
So if you review these questions and if you listen to this video, are you going to be prepared for your final exam?
Should be, if you actually study and pay attention.
Right. So I'm saying that for a reason. You would be surprised at how many students do not watch the Zoom videos. And because they don't watch, yeah, I know you do, Tanya. If you don't watch the Zoom videos, then you're going to miss something that's vital and important. Now, my Zoom videos the Zoom classes are not mandatory. I put them in the assignment. I'll put them in the assignment for today, the lab for today. I put it in the little gray tab area in Zoom classes. And a lot of times, if you look in news and announcements, I put it there too. The only thing I don't do is to text it to your telephone. So
I have a question. Have they fixed the thing online where you can upload your assignments now? As of yesterday, it wasn't.
Some people can, some people can't.
I know as of yesterday evening, it wasn't fixed.
Okay, so Alex, thank you for bringing that up, Tanya, because everybody needs to know. I don't know if you guys remember, but at 8 o'clock last Friday, Genzabar did an update. That has nothing to do with Unitech. We pay for Genzabar because that's an online campus and somebody has to maintain that. Now, it has caused some upload issues for you guys, and I promise you, it has caused some major issues on our end. We're still just working out the kinks and the bugs. That being said, they have given instructors some features that are wonderful. So now we're just having to work out the bugs. So just be patient, please. I know that they're going to get it worked out. Continue to try to upload. If you can't upload, put it in comments. If you can't put it in comments, email it to me and let me know.
I just copy and pasted last night.
Yeah,
and put it in my comment.
There's a will, there's a way, right, Tanya?
There's a way around everything.
There's a way around everything, or way around everything. Okay, so without further ado, I'm going to share my screen and we're going to get into this final review. Okay, so the true false multiple choice portion will be 25 questions. Y'all, it's been Monday.
Totally understand.
Monday.
Today is Monday.
Monday,
seems like it
all day, every day, the whole week. Okay, so number 1 says, if a coder is unable to locate a code that describes the exact procedure, exact service provided, it is acceptable to use a code that approximates the service provided. Nobody wants to answer that, right? Because it sounds tricky. So let's talk about it.
Is it false?
It is false.
It sounded like a trick question.
Yeah, it's false. If you need more explanation in order to amend a correct CPT code, what do?
Look up the answer.
No, you ask the physician. If you're in the real world of coding and you get a medical record and you're reading it and nothing that you're finding lines
Check with
up,
the physician.
right? We call that query the physician. Ask the physician, can you give me more explanation, please?
Go more in depth.
Right. So the thing about it is you may find a code that's similar. And you shouldn't be nervous either, because I promise you, there was never a time that I came across any scenario that I didn't know what the procedure was. You know what I mean? This is just in case. This is one of those in case this happens. If you found one that kind of matched and you sent that off and you got paid, and say that you got paid $596 for that procedure, but the actual procedure was $1,500. If you would have had more information and you've gotten more information and you had used the correct CPT code, what would have happened? You would have gotten paid that money. I promise you, the doctors are going to know. They have this running tally in the back of their head. I've done 4 ABC procedures and that's $1,500 a pop. You understand what I mean? They know where their money. They know where their money is. And so when they're not getting paid that money, who are they going to talk to?
The coder.
The coder. They're not going to talk to the biller. They're not going to talk to the office manager. They're not going to talk to their nurse. They're not going to talk to front desk. They're going to come to the coder and they're going to say, hey, I did 4 ABC procedures last month. And so I should have had, let's say $10,000 come in or payment come in for that. Why didn't I get paid that? And you're going to
because it's up to you to put the correct codes in. If you don't put the correct codes in, then
you're not going to get reimbursed correctly.
They're not going to get
reimbursed correctly. So let me just expand a little bit. So say that you put the closest code you could find in, the insurance paid the money, but it wasn't the right code. So that's a little bit of a mess, right?
Mm-hmm.
So if that happens, what do? Y'all, you got to fill out a form for a form for a form for a form. You have to give them the money back, wait for everything to process. Then you have to refile the claim with the correct CPT code. And guess what? It's going to have the same policy number on it. So they're going to know that they've already had this one to come through one time for that date of service and a similar procedure. So what do you think they're going to do the first time? They're going to deny that puppy. They're going to deny it because they're going to be like, well, we already tried to pay that once and they sent our money back and blah, 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 right? Because they're in the game of not paying. They're in the game of not paying. Mm-hmm. The less they pay, the more money that the third party payer gets to keep, right? Because we're paying in those premiums every month as the policy holders. They don't want to give that up, right? That's why they have so much money. So it's important that if you don't know, if you need more information, do not be afraid to ask. They're going to appreciate the question. So all of that spiel was to say, never be scared to ask the questions. If you are a coder, you want to get what the doctor is owed. You don't want to get more than he's owed. You don't want to get less than he's owed, but you want to get what he's owed. And he has that tally in his head. Okay. All right. So let's go back to this. I promise I'm not going to expand on every question because then we'll be here all day, right? And we just don't have time for that. According to the surgery guidelines, surgical destruction may be considered part of a surgical procedure. According to the surgery guidelines, surgical destruction may be considered as part of a surgical procedure.
Wouldn't that be?
Say it, be confident.
That should be true.
So it's in a surgery guidelines, it's surgical destruction, and it's
Maybe
part
wrong.
of a surgical procedure. It is true. Don't
That's-
probably not. When you look at look at the three in the surgical guidelines, surgical destruction is part of a
Yeah,
surgical
that should be
procedures.
true.
Okay, so that is true. Level 2 national modifiers are located in the introduction section of the HCPCS and also in Appendix A of the CPT. Where are your modifiers found in the CPT besides the back of the front cover? In Appendix what?
A.
In
A.
Appendix A. So is that true or false? It's true. I know it says HCPCS, but the reason it says HCPCS is because P1, P2, P3, P4, and P5 are considered HCPCS modifiers, but we use them in the CPT too. And no, you haven't gone over that yet. When we hit anesthesia, you'll be able to see those. But modifiers are found in Appendix A of the CPT. So number 3 is going to be true. Number 4, the entries in the index of the national codes are listed under one main term. That's false. Just remember that. That's kind of a question that I don't even know.
Actually, it sounded like a trick question.
The entries in the index of the national codes are listed under one main term.
Yeah.
So when you're looking up a code, it's always under one main term. So if you're looking up cough and say that cough is your main term, then your subterms may be cough with bleeding. The next one may be cough with what, you know what I mean? So those are going to be your subterms, but your main term is cough, even though it gave us no frame of reference, right? So that is going to be false.
Okay.
Okay, the words that follow a code number in the CPT manual are called procedure service descriptor, listing order, format descriptor, or identified descriptor.
Mm.
The words that follow your CPT code are called, what is a CPT code? Current procedural terminology. So your CPT codes are procedures. So following your CPT code is your procedure / service descriptor. Come, y'all, I'm gonna give y'all knuckle sandwiches. Come on, we've been doing this. Don't be nervous. So it's procedure service descriptor right here. It's the first one. Who requires a special report with the use of unlisted codes? AMA, third-party payers, CPT manuals, National Center for Healthcare.
Well, it's not AMA because AMA, the one that has to.
Who do we send claims? Who do we send claims to?
Third-party payers.
Third-party payers.
Third-party payers, right? And if you have an unlisted code, you have to
Okay.
send medical records, right? So your third-party payers require a special report with unlisted codes. Those are the ones that end in 99. They always end in 99.
Ah.
Which punctuation mark between codes in the index of the CPT manual indicates a range of codes is available? Period, hyphen,
Dash.
comma, semicolon.
Hyphen.
The hyphen.
We all agree it's the hyphen? It is the hyphen.
I was fixing to say, I know it's the
It's
hyphen.
the hyphen. In which CPT appendix would additions, deletions, and revisions be found? Now we know in Appendix A, we have modifiers, right? Your answer is going to be Appendix B. If you don't remember, what do? You pull out your CPT manual, you look at Appendix B. Or you look at C, or you look at D, you decide, and you decide there. A lot of these answers can be found in your CPT. What year was the CPT developed and published? 1966, 1970, 1983, or none of the above?
1966.
That is right. 1960.
I remember numbers for some reason. I don't know why.
Well, I remember that one only because I've been over it about 100 times now, so I do remember it.
I gotta go get him.
Okay. Category 1 CPT codes have blank digits. Five,
Say,
6, 4, or 7.
is it
It's 5.
5?
5. CPT codes have 5 digits. According to the CPT manual, modifier 91 is not to be used when tests are blank to confirm initial results. So if you looked at modifier 97 in your CPT, I'm going to grab mine. I have the answer key, but I just want to read it. 91. I said 97, but it's 91.
Yeah, that's what was throwing me, I think.
Yeah. Repeat clinical diagnostic laboratory testing. So number 11 would be, if we want to repeat, we're gonna what? Rerun. We need a rerun test. Oh my goodness, Dakota, you can't just put him like that and not let us see his face.
Oh, a baby.
This is Wayne. Look at how big he is.
Mine's in there with grandma, so
Yeah.
I let grandma hold on to her while I do classes or homework.
My other one's at daycare.
Oh,
he
he's
is
holding
so
his head up so
precious.
good.
Oh yeah, he does. He will. He'll stand up too.
He's like, not today,
They
Mom.
didn't want that.
No. All right, so let's move to number 12. Which code is an example of an add-on code? Okay, I'm going to give you the answer so you don't have to go in your CPT and look, but how do you know a code is an add-on code?
Mm.
What does it have in front of it? A plus sign.
Mhm. I'm trying to figure out the answer. That one's throwing me. I don't know that one.
15201 is the answer. So if we go into our
Okay.
CPT and we look at 15201, it has a plus sign in front of it. So it's an add-on code. It's an add-on code. All right. This modifier indicates required waiver of liability statement issued. GX, GY, GA, GL. These are in your Hicks picks. They're Hicks picks modifiers. So in your Hicks picks, the modifiers start on page 102. So we're looking for a modifier that indicates required waiver of liability. So GX, what are the G's? GX is notice of liability issued voluntarily under payer policy. Okay. GY is item or service statutorily excluded, does not mean definition of any Medicare benefit, or for non-Medicare insurers is not a contract benefit. Okay, so it's not GY. So GA, waiver of liability statement is issued as required by payer policy individual case.
It's GA.
Yes, it's GA. All right. Subset Hicks-Picks modifier indicating an opt-out physician providing emergency service. GP, GH, GJ, or GB. GJ says opt out, physician or practitioner, emergency or urgent service. So GJ is going to be your answer for that one. Level 2, national modifiers are found in the introduction section of the Hicks-Picks and also in what appendix of the CPT? Talking about modifiers, where are modifier found and what appendix?
A.
That's right. What year did CMS develop and publish the Hicks-Picks? It's my error, y'all.
1966.
Mm-hmm.
No,
That is not my era, first of all.
not.
No.
Oh, the Hicks-Picks. I was thinking of.
Yeah, the CPT, no, the Hicks-Picks. Let's
Mm,
see. Hair bands were all the rage. Madonna was great.
83.
83.
83. Who said 70?
The young one.
That wasn't me.
70s were like love, peace, and
You know what threw it at me?
what?
Madonna.
Yes. Madonna was the 1980s.
I'm 88, so
Yeah.
Madonna was real.
I wasn't born until 1971, so the 70s wouldn't be it. So, all right. So what types of codes are not recognized by Medicare and other federal payers, but may be useful for claims to some private payers?
Is it S?
It is S. Modifier 79, unrelated procedure or service by the same physician or other qualified healthcare professional during the postoperative period is used on what type of service?
Mm,
So if we look at modifier 79 on the back
Is
cover,
all of the above?
okay, I want you to look at something right here. Keyword. What does this say? Postoperative. So if you're postoperative, operate means a
surgery.
surgery. So your answer is going to be surgery because it's the postoperative period. Okay. Modifier 51, multiple procedures, is used on what type of service? E&M, surgery, anesthesia, all of the above. Stop and think about it. Can you do a multiple procedure for an evaluation and management code? You can't code 2 evaluation and management codes at one time. So that's a no. Anesthesia, you can't do 2 different kinds of anesthesia and get paid for both. So it has to be what?
Surgery.
It has
Surgery.
to be. Can you have more than one surgical procedure at one time? You absolutely can. All right. Multiple modifiers are indicated with which modifier? 47, 50, 22, or 99?
99.
99 says multiple modifiers.
For some reason, I remember that one easily too.
There's no rhyme or reason, Dakota. Well, what we remember, it just some stuff just sticks. The modifier that indicates only the professional component of the service that was provided is 50, 51, 22, 26. I know this one without looking, simply because I used it all the time. Modifier 26 says professional component. So 26, professional component. And you guys are going to be able to look these up and have the time. I just don't want to keep you for forever today. These elements would be part of the blank history, employment, education, and use of drugs. So it's
All of the above.
Social.
Hmm?
it is social.
Oh, is it?
Your
Yeah.
employment, your education, and the use of drugs is all social.
Yeah.
Okay. Medical decision making, MDM, is based on the blank the physician must consider about the management of a patient's condition. Number of diagnoses, risk of morbidity, amount of data, or all of the above.
All of the above.
All of the above. So medical decision making means, how are we going to treat this? So the sicker the patient is, the more diagnoses they're going to have, right? The risk of death and amount of data. So a lot of history, a lot of medical records. And so all of that has to do with medical decision making. Okay. The physician must consider multiple diagnoses and management options. There is a moderate amount of data to be reviewed, and the risk of complications or death is moderate. What is the level of MDM? Straightforward, low, moderate, or high?
Hi.
How many? Let's look at this word right here. What does that say?
Your answer's in the question. It's moderate.
And it says moderate here. So what level are we looking at?
It's moderate.
It's moderate. I did slip
The
some in
question
there that
gives
are-
you the answer.
Yeah, I don't always do that, right?
No?
The definition of low birth weight can be found in the notes for subheading inpatient, neonatal, and pediatric critical care, pediatric critical care patient transport, initial and continuing intensive care services, complex chronic management care services.
Wait a minute.
It's going to be
Definition of low
initial
birth.
and continuing intensive care services. Neonatals before they're born. Pediatric is more than, I don't know why it's not pediatric. Just take my word for it.
Is it 28 days?
Huh?
Is it 28 days? Because 28 days and younger is neonatal, I think.
It doesn't say. It's one of those that doesn't give us a lot of information. So that's why I'm just giving you the answer. Initial and continuing intensive care services. All right. So that is the multiple choice true false portion of your final. Now we're going to do some coding together. Okay. Let me make this bigger.
Was that the entire final?
That's the part one.
Oh,
This is part of part two. We're going to and I'm not doing a whole bunch because if you label your E&M section of your CPT and you do the steps that I've given you in the mini lessons, you are not going to have problems. But we're going to talk about key words, okay? So let's start with this first one. Mr. Jones is admitted to the hospital by the orthopedic surgeon for severe hip pain. The ortho surgeon provides an initial hospital visit during which it is determined that Mr. Jones has a fractured hip that will require surgical intervention. What modifier are we going to use? Surgical intervention. What modifier? Or we could say decision for surgery. What modifier is decision for surgery?
$57.
57. I put the answer right there on that slide. Okay. Mrs. Smith presents to her physician's office for an office visit for an upper respiratory infection. The physician examines the patient and prescribes antibiotics. The physician notices that the patient has a suspicious looking mole. The physician examined the mole and determined that it should be removed. The mole was removed during the same office visit. The physician bills both an E&M code and a procedure code. Which modifier would you use on the E&M code? So I'm going to give you a choice. It's either 24 or 25. 24 says unrelated evaluation and management service by the same physician or other qualified healthcare professional during a post-operative period. 25 says significant separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure of other service. It's a lot of words, right?
Yeah.
Okay, so the other service would be she went to her physician's office for an office visit for an upper respiratory infection. The separate service is that she was examined for the mole and they removed the mole. We are going to have to use modifier 25. Now 24 says unrelated, right? Now, if you look at the two things that he did, are they necessarily related? No, but they're in the same visit during the same examination, but they're significantly separated because one's an upper respiratory and the other is the removal of a mole. So we're going to use modifier 25. All right. This 17-year-old patient presents to the emergency department. So what part of our E&M do we automatically know that we need to be in?
Emergency department.
We need to be in emergency. So does anybody know what page emergency starts on?
$30.
Yep, ER 30. I couldn't find my tab, but it's there. So we're going to be starting on page 30 because we're emergency room department. He had his helmet on as well as all of his racing gear. He actively races motorcycles and has done this all summer long, winning a number of times. Do we need all of that? No, it just gives us a story. So let's keep moving down. Objective, the patient was in no acute distress. Again, not what we need. So if you come on down and you start looking, you're going to read all of this stuff, but this is what you need. The medical decision-making was of low complexity. So we need a medical decision-making of low complexity for new or established patient of emergency room department.
Is it 282?
99282. Does everybody agree?
Yes.
99282 is correct. Okay, the patient is seen in the clinic at the request of Dr. Jones. So if you go somewhere, say that you go to your doctor and they request your primary and they request that you see a doctor for a cardiology issue. What's that called? Give me just one moment,
A
guys.
referral?
Hang on just 1 minute.
Miss Ma'am, if I have to come out one more time, you're gonna get the butt busting grade impact.
Sorry about that. So you said, what did you say, Melinda? What did you say it was?
I don't know. I just say referral.
That's absolutely right. What word do we use interchangeably with the word referral? Consult, right? So we need to be in the consultation portion of our E&M. So consults, let's
I'm
go.
sorry, I thought I muted that, so I apologize if y'all heard that.
Consults start on page 28. Okay,
Okay.
so now that we know where we are, let's say the patient is seen in the clinic at the request of Dr. Jones for evaluation of suprapubic pain. Patient is 22-year-old Black female, and it has all of these specs. Ultrasound was taken at 18 weeks with twin gestation, presents with complaint of suprapubic sharp to mild pain with onset, blah, 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 blah. Her social history, no smoking, illicit drugs. All of these things are important, but we know what we're looking for, right? We're looking for what was the medical decision making. Now, this was an office consult, and the decision making is straightforward. So we're looking for a straightforward MDM.
251?
Okay, 99251, you said?
Yeah.
Okay, that says inpatient consult. 99251 says inpatient consult. We're looking for an office consultation.
We have 241 and 242 are both straightforward.
Okay. So let's make an informed decision. Let's look at what's all wrong. Patient, she just has pain, right? So do you guys think that's problem focused, or do you think it's expanded problem focused? Oh, look right here. I missed it. During an expanded problem focused examination. I missed it on purpose so that you guys know that when you see one thing that you need and it's unclear, go back and look again. So it's expanded. So what's our code?
252? Oh, never mind. It's the inpatient.
Yeah, you need to get over to office patient. It's an EES. Dakota, do you have the code?
242.
99242.
Sorry if I hear the dog. I promise the dog is outside of the far corner of the yard.
It's okay. So 99242 is an expanded history, expanded exam, and straightforward decision making. And so that's what we were looking for. We were looking for a consultation because it was at the request. Remember, kind of look at those and think about it. Then we found out it was an expanded problem-focused exam, and MDM was straightforward. Do y'all see how I pulled out those words and my eyes immediately kind of go that way? do I expect for you to be able to do that so fast? No, but this is experience. You know, you're going to start reading medical records and your eyes are going to go straight to what you need every time, and you're going to ignore what you don't. Okay. This 15-year-old girl never seen at this clinic, which makes her a what?
New patient.
A new patient. During a problem-focused history, she states that she noticed a lump on the back of her right wrist yesterday. There is a 2-centimeter freely movable rubbery round swelling on the dorsal surface of the right wrist. MDM was straightforward complexity. So never seen at this clinic tells us that she is a new patient. We're looking for problem-focused history, and the MDM is straightforward.
Is it 231?
Nine 99231. Okay, so 99231 says subsequent hospital care. How does that go with never been seen at this clinic, so she's a new patient? So we need to go all the way to the beginning of our new patients, which starts on page 19. We have straightforward complexity. Tanya, do you have your manual out? If you're talking, I can't hear you.
Sorry, I muted it because my child was screaming. I think I've got the wrong one. It should
What
be
do
the
you think you
CPT,
got?
right?
The CPT.
That's why. That's why I couldn't find anything.
Girl, when you don't come to class laying in bed, you better get up and get your books out. You make me fuss at you in class today. Come on now. All right, Miss Melinda, you're on. Straightforward complexity, new patient. Page 19.
Is it 99202?
It is. Ding, 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 ding. All right, the next one. A 7-year-old female established patient was seen by the pediatrician complaining of ear pain for 3 days. A detailed history is then taken. She had associated fever, blah, 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 and the medical decision-making is moderate. Established patient, detailed history, moderate complexity. Now you can go to established patient, Melinda.
Is 214?
Whoop, look at you. Yes, it's 99214. See what I said? Once you know where you're going, once you pinpoint where you're going, it's easy from there. Okay. Sally is a 42-year-old female who presents today for okay, let's talk about it. Routine physical examination. So if she presents for a routine physical examination, that is going to be preventative medicine. She's not there for any illnesses, right? She's just going for a routine exam. So that's preventative medicine or preventative care. That starts on page 48.
No, I picked up the wrong book.
So it does not indicate that she's a new patient. So we're going established patient here. She's 42 years old. She's an established patient, and we're in preventative medicine, which is broke down by age. So established, 42-year-old.
$396.
99396 says 40 to 64-year-old established patient, preventative care. That is correct. Melinda, good job.
Thanks.
Y'all, did my share turn off?
Mhm.
So y'all didn't see any of these.
Mm-mm.
It's been off.
Well, it's too late now.
It's recording. We can always go back and look at it. We've got
That
books.
whole thing. And the share cut off.
I thought you intended on it to cut off.
I spent all that time making these slides. I could have just read it off a piece of paper. When I tell y'all it's been Monday every day this week, it has.
It's been